As the pandemic continues, so does the question, can children spread the virus?
A new study takes a look at that. CBS 2's Dr. Max Gomez has more in tonight's Max Minute.
As the debate whether, when, and how to reopen schools rages across school districts, parents worry, could my child get infected with coronavirus in school? And if they do get infected, could they bring the virus home and spread it to others in the household? Since the beginning of the COVID-19 pandemic, studies have shown that children have been less affected than adults in terms of frequency and severity of the disease. This does not mean that children are immune to COVID-19. Children of all ages can and do contract COVID-19. In fact, in the U.S., children under 18 represent more than 5% of laboratory-confirmed COVID cases. And while the vast majority recover, there have been more than 300 pediatric deaths reported to the CDC. As for whether kids can bring the virus home to mom, dad, siblings, and grandparents, the evidence is thin. But a new study in the journal Pediatrics concludes that rarely are the young ones bringing corona into a household. A Swiss study of medical records of 39 coronavirus-positive children under age 16 and whose household contacts were then carefully followed during a month from early March to early April, the peak for COVID cases in Switzerland. In only 8% of cases was the child the first to develop symptoms, leading the researchers to conclude that child-to-adult transmission was relatively uncommon. It's not clear why children may not be good coronavirus spreaders, but it's certainly not impossible. So the recommendation for extra caution when there's an at-risk adult in the home still stands. Dr. Max Gomez, CBS 2 News.
If you would like to ask Dr. Max a question, just go to cbsnewyork.com/max.